So the FLIGHT clinical trial was a randomized, open-label, multi-center trial comparing standard of care, which is corticosteroid alone, versus corticosteroid plus mycophenolate for first-line treatment of ITP. And the reason why we wanted to test this approach is that the standard of care of corticosteroid alone has several downsides. So not only do most patients have side effects from steroids, but also there's a heterogeneity of responses, with some patients, about 30%, not responding at all, and the other patients most likely to relapse at some point in the future, which means that only about 20% stay well long-term with this approach. In the UK, we use mycophenolate quite a lot as a second-line treatment, and there's retrospective data that suggests it has good efficacy and tolerability. So the hypothesis was, if we treat patients with mycophenolate at the beginning, then potentially we can prevent that almost inevitable treatment failure of corticosteroid alone. So the primary outcome was time to treatment failure, which we defined as a platelet count of less than 30 and a clinical need for second-line treatment. And included in the treatment failures were patients refractory to treatment who didn't respond at all, and also patients who initially responded but then subsequently relapsed. For the combination, there were only 6.8% who were refractory, and overall 22% experienced a treatment failure. For corticosteroids alone, it was 44% who experienced a treatment failure, and there was a significant difference between the two groups. So you're roughly 2 times as likely to have experienced a treatment failure if you were randomized to corticosteroid alone. Interestingly, when we looked at side effects, they were actually really similar between the two groups, and predominantly were related to corticosteroid treatment. So that would be weight gain, psychological disturbance, and things like that. In actual fact, the rates of infections were really similar between the groups, as well as the GI side effects. So it didn't seem like mycophenolate was adding much in the way of side effects, which was really interesting, particularly as it was a very elderly cohort that were included in the trial. I would say that's a really difficult question, and I think it's very difficult to say that this should now be a routine first-line treatment option for ITP. And that's in part because over half of the patients treated with corticosteroid alone remained in first remission at follow-up. So potentially, had they received mycophenolate, over half of those may have been overtreated. And then the other thing is that some aspects of the quality of life appear to be a little bit worse with mycophenolate. And we don't really understand why, and whether that's because of the elderly population that were included, we just don't know. So I think the key would be to try and better stratify patients at diagnosis and try and target mycophenolate potentially for those who would be expected to do poorly on corticosteroid alone.